That's unanimous. So let me go ahead and move to the financial summary. And I see Jeremy's here today. Welcome, Jeremy.
Good afternoon.
So did you want to do a quick summary for us or anything that you want to draw our attention to on the financial summary or financial report that was provided in the packet?
We don't have any real significant changes to what you've seen over the last two. But what I wanted to bring everybody up to speed on a little bit is just where we are in the year. So we are doing all of our sort of year-end forecasting right now. We're trying to ensure that we will meet budget and not exceed it, and making all of our, budget adjustments accordingly. So as we go through that process, we currently don't have a significant need or a significant overage, but we do have a lot of good internal data as far as, making sure that we'll be able to pay for all the staff by the end of the year, even with increases and the such, that we'll be able to cover all of these larger expenses. So the budget's in a pretty good place. We have a lot of good information about it internally. It gets reviewed every single month. And so that if there is something big, we should be able to draw your attention to it quickly. But at this point, I didn't have a significant line item or anything like that we're going to go over, or a discussion to be had there.
Yeah, that's fine, Jeremy. Thank you. We just like to check and ask to make sure there's not something that we don't see that you're seeing that we need to be aware of. Are there any questions from board members on the financial report? Okay, thank you. Dr. Claypack.
I've mentioned two things. One, this is Domestic Violence Prevention Month, so we just want to emphasize to the public that this is a very important subject, and it doesn't have to be physical violence. It can be verbal violence, and it can be not only between partners and couples, but could be violence against an elderly person in your family. It takes all forms and shapes. And we have very good information on our press release about that. So we hope people will read that and become more informed. And this is Lead Prevention Week. And this afternoon, Liz can speak more to it probably than I, but this afternoon there's an event down at Reuse Center, right? And people can take objects and have them tested for lead content, and learn more about lead prevention. Tomorrow morning, I'll talk about it on WHCU. And I think we want to emphasize that the major sources of lead poisoning in our region are paint and contaminated soils. And largely those sources are the prime ones, although we occasionally run into jewelry from foreign countries or supplemental products that are contaminated with heavy metals. So those types of things are good to be careful about as well. Glad to take any questions about my report. I'm glad to say that in the intervening 10 days since I dictated it, that regarding infectious disease, that really nothing has changed.
Okay, any questions from board members? I'd like to just always say my one takeaway was about adult tick season starting. So I didn't realize that. So that was a nice little piece of information in there. So just needed that.
Yeah, I'll have to say from personal observation that the ticks I'm seeing are still very small.
Oh.
They aren't like the big ones that you hope to see. So you still got to look for those tiny ones.
So make sure to check yourself if you've been out in the backyard. So.
My kid has Lyme.
Oh, no. Okay.
Okay, thank you very much. Frank.
Sure, just one thing to add, we had our walkthrough with OMH on the space back here for the mental health clinic, and everything is in alignment now. And we have scheduled November 12th as our opening date to begin seeing clients in the space here in the building. It'll be a bit of a soft launch as we kind of get things worked out. There's a lot of scheduling nuance because we're not just opening a new satellite with all new clients and all new clinicians. We're using existing staff and existing clients and trying to make matches both for the clinicians that want to be here and the clients that want to be here. And then how do we serve the ones that want to stay downtown and such? So it's going to take us a little bit to kind of work through that, but we're excited to finally have the opening date set for the November 12th. We'll probably try to get a couple of months under our belt before we do a kind of more formal announcement about it, just to make sure that we've got the bugs worked out and kind of understand what our capacities are here. But exciting to have that finally happening.
How many new clinicians do you have?
We don't have any new clinicians specifically for this project. We have expanded our clinician pool over the last couple of years. We've added, I think, 3 positions. 2 of them are in our children and youth program, which is going to be the focus here initially. So some of those folks will be staffing this facility.
I actually appreciate the fact that we have a location that's not in the city of Ithaca. Parking downtown is such a barrier for so many people, especially if you're going for a 45-minute appointment. You could literally look around for 15 minutes for parking, and people don't want to spend the $5, $10, whatever it is to pay for parking. So I'm glad we have a nice area where people can park outside, and it helps, Lansing, Dryden, it helps everyone in the rural areas, make it a little bit easier.
Absolutely. There has been no shortage of interest either from staff or clients.
Yeah.
So hopeful.
I also just think it's a comfort thing too, for some folks like that who maybe don't experience downtown Ithaca on a regular basis, that can feel frightening, right? To go down there, even though for some of us, it's like, oh, it's just a little small town community and it's fine. I mean, I think that having this here too helps. And so Frank, can you talk just a little bit about the appointment process and how you're making decisions about who comes here? Is it like when you call the doctor's office and they say, you have a choice, you can be seen downtown or up here? Is that how?
Yeah, so we did reach out to our clients that we currently have, gauging interest on what location they would be interested in.
Okay.
So now we're kind of matching the clinicians that are going to be here with the clients that are on their caseload. Once we kind of get that part of it worked out, eventually what will happen is if you come in if you call for an appointment, for intake, you would be asked which place you want to go to. But we're also hoping to have intake in both places. So folks would be able to just walk into this building similarly as they would walk into downtown. So they would kind of decide which one was more convenient from them. So new clients will have the option in the future. Right now, we're focused on existing clients and caseloads related to the staffing that'll be here.
Any other questions, comments? Okay, thank you. Let's move to Rachel and our Division for Community Health.
Few things just to highlight. They're both in my report, but my hiring success continues. I hired 1 more nurse. I'm very thrilled. So we have another nurse starting November 12th, actually, the same day the clinic is opening. Rose, so she will be working in maternal child health, replacing Deb Axtell, who retired. And then our back to school immunization season was very interesting this year, just a larger volume of kids than we've seen before. So meeting with Frank and Dr. K and Melissa to talk about, what's happening in the community that's causing that shift. We were able to accommodate with the staff we had hired. We ran double clinics and booked extra days, but it was a big effort from our team. So more to follow on that.
Did you come up with any conclusions of what is happening in the community to drive that?
Well, we're going to be talking about it. There is possibly, it seems like there's more barriers to families getting into primary care. overall, but there's a lot of factors that go into that. Some of them are social determinants of health, like transportation, lack of insurance. People go to urgent care to get sports physicals, and urgent care doesn't provide immunizations. There's multiple, there's sort of a multi-pronged thing happening, so we'll chat more about it.
Questions, comments? Okay, thank you, Rachel. Sam, health promotion.
I don't have any other updates except that we did complete our community health worker interview process and did hire someone who's starting on Monday, Sarah Charles, and so we'll be up to 4 community health workers for Stafford Wild, which is our full staffing for that program. So yeah, we're excited to bring her on.
Any questions, comments for? You. I wanted to thank you for the COVID squeegee balls, which we used at, we just did a flu vaccination exercise on campus. That's the first one we've done since before COVID. So I think we did about 450 to 475 flu vaccinations, which was a big deal for us. And everyone was super excited because they got prizes at the end, which included the, yeah, so thank you very much for helping to support that with those. Okay, children with special health care needs, Jessica.
Nothing to add. We've just been busy with the launch of the new EI hub from New York State that was last week. So been learning the system. Did some of the funkiness stuff.
Can you just remind us what is the EI hub? What is that doing?
Yeah, so it's replacing a system that was called NICE. It's the early intervention system from New York State Department of Health, where we put all of our information in for the kiddos that are receiving early intervention services. Yeah.
And it's nice to see that you're starting to make some dent in your waiting lists.
We are. Slowly decreasing, slowly. Hope that trend continues.
Any questions, comments from board members on that? Okay. All right, Liz, environmental health.
I don't have anything to add.
Any questions for Liz on her report? All right, then let's move to our administrative actions. Our first one is Demoka Coffee. Second, let me get to the actual. So this was for a failure to obtain a permit to operate food service. So if I could get from board members an approval, motion to approve as written. I have a first from Ed, second from Samara. Any discussion or questions for Liz on this one? Okay. All in favor is written. Unanimous. The second one is at the yacht club for Luna. This was a violation related to thermometers, I believe, right? And being able to use food probe thermometers for storage, cooking, cooling, and holding. Motion from board members to approve as written. The first from Melissa, second from Samara. Okay, any additional questions? Comments? Okay, all in favor is written. And that's unanimous. So those we're through that. We don't have any new administrative actions for this meeting, but I would just give board members an update on the replacement process for Sue Merkel's position. So we are interviewing 3 candidates this Friday. So should be able to come back to the board next at our November meeting with some recommendations so that we can get to the legislature after that. All right, anything else for the good of the group that we need to discuss?
Is our November meeting?
It's a combined meeting.
December 3rd.
I'm so sorry, December 3rd is the next meeting. Anything else to discuss? I'm gonna go ahead and adjourn us. We've covered everything in our agenda. Thank you.
Yes.
I wonder about my lunch.
I finished his lunch meeting first.